with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. This is Peggy Smith, your holistic nurse on the Bold Brave TV network. And today we have a very special guest from California. Her name is Seth Deborah, and she's a nurse anesthetist and a medical clinical hypnotherapist. And she's going to be sharing with you some of the things that she does in addition to her traditional medical work as a nurse anesthetist. So Deborah will be joining us shortly. And we'll tell you more. Deborah has, she's known nationally because she was on, she had an appearance on Discovery's channel, Mythbusters segment about hypnosis. She has specialized in certifications in medical health hypnosis. She is a fellow with the National Board of Certified Hypnotherapists and a certified hypnosis instructor with the National Guild of Hypnotists. She was inducted to the Order of Braid with the National Guild in 2011. And in 2012, she was included in the top 100 nurse practitioner list. 2013, she received one of the highest awards that the National Guild of Hypnotists bestows on someone, the Charles Tebbets Award. And she's had awards of excellence with numerous other organizations. She also presents at various colleges and integrative health forums, has presented internationally for conferences on medical hypnosis and integrative health. And currently she's living, I believe, in the San Francisco area around Oakland and Berkeley. She's certified, and she's also with the International Hypnosis Federation. And she has presented at the Association for Professional Hypnosis and Psychotherapy in London. So Seth Deborah will be joining us.
Hello, hello. Can you hear me?
I can hear you. Yes, hello.
I'm laughing because that's one of the things that happens as you get older. Your bio gets longer.
I know somebody wanted an updated resume. It's like, are you kidding? How do I put 45 years in one page?
Exactly.
Especially when you don't want to be in that field anymore. But so how did you get interested in hypnosis? You were a nurse at that time?
Yeah, I was actually a nurse anesthetist. Well, a student nurse anesthetist. And I trained in Brooklyn, where the mafia is real. And one of the a fellow had lifted a garbage can cover and a bomb went off, and he had burns over his face, and we were going to do a skin graft from his leg to his face. And because the anesthesia mask could not go on the face, right,
Yeah.
because of the burns. And you have to remember, this is like 1973, 74. And we didn't have the equipment that we have now. And anyway, so because the mask can't go on the face, your gases are mixed with air, and it's basically does nothing. And so my instructor, Dr. Margaret Blumenfeld, she had been a surgeon. She was from Russia originally, had been a surgeon in China, and then became an anesthetist. But anyway, she started talking to the man, and suddenly he just tilts his head and goes to sleep. And I thought it was just what Dr. Blumenfeld did. I didn't realize what she was doing was hypnosis.
Okay.
So my
I would
first
have thought, do we need to call a code or something? No, without any more. If she wasn't upset, I guess you don't have to get upset.
Yeah, and then they just did the skin graft, and he just lied there, head tilted and like in a hypnotic trance. And so many years later, 1987, I was 2 weeks away from spine fusion. I had pain going down my leg and a lot of car accidents here in California with drunk drivers, for real. for real.
I
I'm
was in
originally
Southern
from New
California. I learned how to drive on those LA freeways.
York. Yeah. So I started putting my hand on my hip because the pain was going down the right leg, and I started doing visualizations, and suddenly the red arterial blood going into the nerve root, pushing out blue venous blood, being the medical person I am, and suddenly my legs started to release spasms of energy. And then my hip, with the increase in circulation that I was imagining, started to literally rise and fall. And I'm here actually in this room on the floor in my living room. And I called my husband over, who was a surgeon. I said, Ken, look at this, look at this. And my hip is rising and falling. And I just did this healing all the time and never had the surgery. And that was 1987. And now I
That was
dance
more
every,
regenerative medicine too.
yeah,
Yeah. When
it
I
was,
needed the surgery, I was actually considering regenerative medicine. I wasn't going to let go to the operating room. But that's
yeah,
amazing. Yeah. Your
yeah.
husband was very supportive of these ideas. He didn't think you were crazy.
No, as a matter of fact, he used to say he was a urologist, and he would send me all his bedwetting patients, and he'd send me his interstitial patients, and also his sexual dysfunction, non-organic,
Okay.
right? So yeah, he was a big supporter of mine, a really big supporter. Yeah, yeah,
That always helps when you have support in the family.
yes,
So
and in the
how do you,
medical profession too.
it's true because I know when I first started, my first husband was an engineer, and he used to tell our kids that mommy's playing with the astronauts or the Martians with the energy meds and stuff. But so, how do you differentiate like hypnosis and medical hypnosis? Is there a clear differentiation, or is just whatever situation you use it at?
I think it's whatever situation you use it. I mean, medical hypnosis deals a lot, in my experience, with getting to the root of many issues. It's like, and so I am a big believer in regression, like what was going on 1, 2, 3 years before you got sick. I just recently had a fellow with a chronic cough,
Okay.
and it's he's gone through all the tests and everything like that and medications, and they can't find a reason. And I worked with him, and I have him feel the feeling before he gets the tickling in the chest and the throat, and he goes back to something fairly recent, and that is the feeling of he's recently retired, he's moved to Florida, his wife is busy in
Yeah,
her
that
own,
was a good.
and he feels lost. He doesn't know what to, he's just,
Yeah,
and he wasn't facing that issue that was bothering him. And just in getting that understanding of where this was coming from, that feeling of uselessness, it's fading away.
okay.
In 2 sessions, it's almost not there now. And he's become very aware of it. And so
Uh,
I've taught him how to go into that feeling and go through the feeling instead of pushing it down. And yeah, so
okay.
yeah, so also I remember originally I was an oncology nurse, and again my first back in 1969, and again it's what was going in your life 1, 2, 3 years before you got cancer, right?
Right.
And so
Well,
you'll
stress is
find
one of the biggest causes of cancer we know now. And
yeah,
it,
yeah,
yeah, that's my specialty is oncology. And I remember as a student, doing one of my clinicals, and this woman was on the oncology floor. It was maybe January, February, and she told me that she was going to go be with her God on Easter Sunday. And I
uh-huh,
walked out there thinking, well, sure she is,
right.
who plans when they're going to leave us? I happened to be working Easter Sunday and she was in the hospital again. And that's when she left us. And, it really made me think about how strong the mind is. And.
The same thing happened with my aunt Yitta. It was, she said she'd never die on a holiday. It was a couple of days before Thanksgiving. She said, what day is
That's a
it? Blah, blah,
holiday.
blah. and she died on Friday because she never wanted to die on a holiday. Yeah,
So
fascinating.
a lot of people do die between Thanksgiving and New Year's, and I'm not sure why exactly that is, but it makes it rougher for the people left behind for sure.
Absolutely,
Yeah,
absolutely.
but yeah, that's really neat. So I guess you didn't need any convincing about it being real. Have you found a lot of any resistance at all with your clients that maybe some came to you? Well, I love the ones that say you can't hypnotize me because they're the easiest to hypnotize. Control freaks.
One of my the a good thing I did in my hypnosis practice is that I took a stage hypnosis course, and so I
Okay,
learned a lot of great convincers, which is a good thing to use for a person. I remember even myself the first time I was quote unquote officially hypnotized, and the feeling of my arm going up with a balloon was just like
right.
amazing to me. And then you open your eyes and your arms are separated. It was a convincer, right?
Well,
And
I went to an NGH conference, a long time ago. I was determined to be the doubting Thomas and prove that stage hypnosis wasn't real. So I
uh-huh.
said, you can take it, you can videotape me and everything. I want to see how this looks. And, I didn't dance like a chicken or quack like a duck, but I did things I wouldn't normally do in public. And, and I'm a hospital clown. So I thought about that often,
I tell people if I say the stage hypnosis shows are real, but if we can have you cluck like a chicken, imagine how you could feel that your stomach is full with half the amount of full food, right?
Right.
And they go, "Oh, okay." Right? And then they become more receptive to it.
Okay. Have you done many of the gastric band and bypass hypnosis sessions? Or
I had done it. I studied with Sheila Granger.
okay,
Um, it's a good one. It's a tool to have. Personally, when you're dealing with weight issues, it's more about facing your feelings than eating your feelings,
okay,
right? And that requires some looking into what's going on and releasing a lot of the old ways of behaving and establishing new ways of behaving and giving people tools that they need that they can use on their own when life happens, when the ups and downs happen.
right,
But it's certainly a tool to use for some people, right? Um, I don't use it that often anymore. I did when I first got trained in it. But I do have them look at one of the techniques I like to use is when people to explain to people about the size of your stomach, that it's the
okay,
size of your fist,
right.
and then put them in trance and then have them open their eyes and look at their fist and say, that's the amount of food. And you feel comfortably full with that amount of food. I also tell them, why is it that perhaps, and perhaps is a great word that was taught to me from Marilyn Gordon. I don't know if you remember her. Yeah,
Yes,
my initial instructor. That perhaps the French women, they have all kinds of creams and sauces and croissants and they stay thin, right? Well, if you ever look at the size, if you go to a French restaurant, the size of the portion of food is very small, right? So again, it's being aware that this is all the food that you need in one setting, in one sitting. And so I find that very helpful for people because people really aren't aware of it. And of course, you could overstretch the stomach and you have to retrain it to get smaller because it is muscles and you are retraining. But you don't need as much food as you think you do.
yeah. Portion control is a difficult topic to get through the people having the surgery. That's a big challenge for them.
Right.
So, what do you think of the mind body connection then? I guess you've
Oh,
had many examples of how strong that is.
it's so real. It's so real. I'll share a story with you. My husband and I were at a picnic at my daughter's school, and somebody comes out from the redwoods. Uh, a friend of his has fallen on the bicycle, And so we went there, walked in, and when he fell off the bicycle, he hit his head on a rock and
Ooh,
also his nose, and the teeth, when they were coming out, split his tongue and his lip. And so he is bleeding. Well, first thing we did, we checked his consciousness, blah, 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 blah. But he's bleeding. And so we
right.
looked for someone somehow gave us a t-shirt, and were putting it on his lip and tongue to stop the bleeding. But because he had broken his nose, he was swelling, right? And
Okay.
we had to take away the t-shirt. And I had just seen a couple of weeks before that uh, a, a video that Melissa Tears had shared with me about dental school in Pennsylvania, I think, where they had a stopwatch. They were timing using hypnosis to stop bleeding. Okay, they had
Okay.
put a needle in the hand and it's bleeding, and they used hypnosis to stop it. I had just seen this. And so I'm telling the fellow, I'm a hypnotist. I can help you. Would you like to stop your bleeding? And then I started talking to his arteries, his capillaries. I thanked them for doing the job. They were cleaning the wound. Now it's time to stop the bleeding. And the bleeding just stopped. And my husband and I looked at each other and we quote said, "Shit, this stuff really works." The medical people, and this is a long time ago, but the
Right.
medical people, we are still human beings, and we didn't believe that this could really happen. But we saw the bleeding stop. And then I went ahead and I worked with the pain controls because it was taking like a long time for the paramedics to arrive. It was at least 45 minutes because we were in the Redwood area.
Okay.
So the mind body connection is real. And when I talk to new clients about it, I said, well, you stand up in front of a classroom and you feel like you're going to give a speech, you feel like you're going to upchuck, or your arms are sweaty, your hands are sweaty. Where is that coming from? That's coming from the fear that's stimulating your brain, that is stimulating different neurotransmitters and hormones that go to all your different organs. And you're having either a sympathetic response or a parasympathetic response, depending what kind of thoughts you're having. And then I
Right.
go on.
Well, they're identifying anything with hypnosis in that situation. I took a Dale Carnegie course years ago, and
Uh-huh.
you're supposed to visualize the audience in their underwear or something, and then you laugh and you're relaxed. We're going to take a short break right now. I'll be right back with you. Thank you.
Okay.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick, Wednesdays 7 p.m. Eastern on the Bold Brave Media Network and TuneIn Radio. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them.
We discover and assess their core values, philosophies, and competencies. Find settings that allow them to be the most productive and track their progress towards accomplishing goals. Listen to John Hawkins' My Strategy, Saturdays, 1 p.m. Eastern on the BBM Global Network and TuneIn Radio.
Hi, we're back with Seth Roth. She's a certified registered nurse anesthetist as well as a clinical medical hypnotist. And we were talking about the mind body connection. Um, I'm also a Reiki master, and Reiki is one of the things, it can stop bleeding very quickly. But if you suspect a broken bone, you're not supposed to use Reiki because it will heal the bone too quickly and not in the right alignment.
Wow, I
Uh,
didn't
that's
know that.
actually one of the, when we teach the classes, we explain to people, it's great to stop bleeding, but if there's a fracture, that's not the time to use it.
I used hypnosis for my torn meniscus. I had a torn meniscus and an ACL, and you could see on MRI. And I worked
Right.
with another hypnotist. I had to wait 6 weeks because it was football season and they didn't have any donor ACLs. And so I worked with a hypnotist, Olga
Okay.
Holtius, many years
Uh-huh.
ago, since passed. And we did that visualization of it being healed. And again, the medical person in me was resistant, and I went into surgery. They fixed the ACL, but Dr. Dillingham, the 49ers doctor, came out
Okay.
and said, I don't know, the meniscus, there was nothing to do. They had healed. So I know it happens. From personal experience, which for me
Right.
allows me to transmit that to my clients, that I was a non-believer too. So
Yeah.
yeah.
I'm a cancer survivor, and I used to visualize when I was taking a shower all the cancer cells going down the drain. And I had mentioned that a couple years ago to a patient that was struggling with some issues. And when I told her that, she says, I do the same thing. And
Yeah.
yes, I thought I made that up, and found out a lot of people, a lot of us do that. We didn't, just
Yeah.
self-preservation. The mind tells you. And I've also found with the strong mind body connection that if you ask inside what you need, your mind usually can give you the answer. Uh,
Absolutely. I call it body talk. I was c- communicating with one gal, and her name was, the stomach had a name, and it was called Sally Stomach, which I've thought about doing a book about this kind of stuff. And anyway, the stomach gave her all the answers she needed, all the answers. And I actually talk to people that the body is speaking to us in its language. And so when in trance, I ask them to ask the body to talk to them in English, right?
okay.
And
Right.
then it comes out. Yeah.
Yeah. Well, many people's stomach talks to them, from the bathroom, and you shouldn't have gone to the fast food place today. And
Yeah.
uh,
Yeah.
my mother used to have a saying. She was first generation Polish, and it was, if you have to ask, you know the answer. From a child's perspective and all, but that kind of applies to everything.
Yeah.
I realized I understood it better when I was an adult. I used to be angry because, it meant don't ask your father and you already know the answer. But, I think in her own way, she had a lot of, when she passed, she was like cleaning with vinegar when it wasn't in fashion. And she had a whole bunch of holistic, home needs, home care things that she was doing for years.
And
It's,
probably not as toxic also,
Now,
right?
I remember in junior high when everybody was coloring their hair and I wanted to at least get highlights, she let me put lemon juice on my hair.
I
And
remember having this, yeah.
yeah,
My
and
friend also.
yeah, she had me soak my nails in Knox gelatin. And she didn't know anything scientifically why that would help your nails, but that's what she did. I don't know where she picked that up. But things that I kind of was resentful of at that time, when you grow up and learn more worldly things, you realize, yeah, gosh, she really was pretty smart, you
Yeah.
know.
Yeah.
And and it's much cheaper too when you
Mm.
do a lot of holistic things. especially with the insurance challenges. If you can do certain things without the medical procedures, and I don't recommend just making that decision without medical collaboration. Um, you don't have to get the insurance pre-approvals, and your bills are a lot less sometimes.
Yeah.
um, you mentioned dentist and surgery. I know I often putting IVs in people. I use hypnotic techniques without telling them that's what we're doing, or I'll just control my breathing and their body picks up on it and breathes the way I breathe. And um, the ones that are really like, so many people stop breathing when you put an IV in.
Yeah.
uh, and the blood's not going to flow if you're not breathing. And people didn't realize that. Yeah, I'll say, would you mind taking a breath? And but what other areas? The dentist, the surgeries, certainly the psychiatric community is a good place for that. But uh,
What I find is really using the mindset of before you go into surgery.
okay,
Having just myself, I experienced a total knee like 9 months ago, and there are a lot of hiccups that happen when these surgeries can be pretty extensive. And how you enter before the surgery is really an important thing as far as anesthesia goes. Having someone enter into that state, being more calm, relaxed, so you're not having to give them more medication during surgery, and you're not fighting their blood pressure, fighting their pulse, giving them medication to counteract the high blood pressure. If you could just work with them beforehand so they don't have a high blood pressure before you're
right,
putting them to sleep, you're
yeah,
way ahead of the game. And also, in the recovery process, in the recovery room for pain management, but also post-op, the physical therapy that goes on, the mental crap that happens with all the narcotics that they're given, right?
right,
Maintaining that positive attitude, whether it's when you're going through physical therapy, so that you're able to really be part of your healthcare, right? And
right,
really stretch as hard as you can stretch, do your home exercises. When hiccups happen, cope with them, right?
right.
And so all these things, if you have the right mindset, you will heal faster. I mean, they've done studies at, I think it was Mount Sinai, where just 45 minutes before, I think it was breast biopsies, they actually saved 45 minutes of hypnosis, right? When you're in the holding area.
Okay,
And they actually saved about $770 per case because people needed less medication during the surgery, and also they were able to be discharged sooner. So it's a place where it's not utilized. And
right,
even if you could do something just in the holding area when you're starting IVs, and people are there for an hour before their surgery, worrying about the worst that can happen. Or they're talking to the next door neighbor, oh, well, I had this surgery and I'm back for a resurgery. It's like you don't want to listen to the horror stories. It's not
yeah.
good.
When I was in my pediatric rotation, we had the instructor was talking about anesthesia,
Uh-huh.
and she was relaying a personal experience where all I got out of that day was never give me general because of whatever complications she had. Well, I have four very healthy living adult children, but I had seven full term stillborns over the years, which
Wow.
usually resulted in a trip to the OR to get things together. And the night of that class, I ended up losing another child at full term, and I'm in the hospital. They're putting me, the anesthesia's talking to me, and all I can hear is Harriet's voice, never give me general, never give me general. And that's how I went under. I ended up on a ventilator for about 8 hours because they couldn't get me off the ventilator. And I
Wow.
know it was just because of my mind saying, don't do this to me. you know, I've
Yeah.
had, you know, surgeries other times and no problems with anesthesia. But the mind is very strong.
I've
I
canceled cases where people told me they were going to die. and it was an elective surgery. I've spoken to the surgeon and I say, we need to cancel this. And
Okay.
yeah, yeah. It's not a good feeling to have that fear when you go into surgery. Not at all. It just
Yeah.
sets up a whole cascade of not good things.
Well, I think probably one of the most common phrases I've used over the years is that the anticipation is almost always worse than the actual event. And
Yeah.
when we're dealing with the anxiety issues, and for any kind of anxiety, um, and it's true. It is. Everything goes into your perceptions. What you've heard your grandparents and aunts saying when you were a child, and yeah,
I'm actually giving a presentation at the California Association of Ambulatory Surgery Centers in September on the topic of using hypnosis. And I'm not sure I'm going to call it hypnosis. I think I call it mindset in
focus
preoperative.
and relaxation.
Yeah, in the medical field, if you use the word hypnosis, that sometimes I think they think we're going to get sued, and so there's that push back against it. So yeah.
Well, I know here in Philadelphia, we have the Jefferson Medical System, which has a lot of integrative medicine departments, and they're getting more progressive. They're teaching the medical students about it, which is where you
Oh,
have to start.
wonderful! Isn't it
Yeah,
funny how the East Coast is more progressive than the West Coast? You would think here in Berkeley area,
right.
but not at all. I hit a lot of resistance. Yeah, yeah.
Well, when I was down south, though, there's a lot of resistance. I had a patient, a home care patient, very really bad pain issues, living rurally, and I had said she tried everything, even acupuncture, and I said, well, have you tried hypnosis? And she goes, honey, you're not in Philadelphia anymore. Where do you think you are? And I looked at a directory. There was less than a half dozen in the state. It's in the
Wow.
Bible Belt. It's not accepted in many places.
Yeah, yeah.
Um, yeah. So um, well, you've already talked about using it before surgery. How about with children? When you hypnotize children, I know I always tell the parents, you're welcome to be in the room. I don't think especially the younger children, I would want the parents there so there's no misunderstandings or anything. But uh, is it just like kind of creative visualization? You're talking about imaginary friend that's going to be there with you, or what do you
Yeah,
do for the children?
I remember had a little boy who had a problem taking exams, and I
Okay,
think third grade, and we imagine Hulk. Was it the Green Hulk? Whatever it
right.
is. Yeah, and he took a little figurine with him into the classroom, and it really, that he was there helping him along, and so you could do things like that. I'm actually going to be working with uh, two children. I don't even know if they're both girls or one's a boy. It's just coming
Right.
up soon. But what I told the mom is, I and I tell the children, I will. You can tell. I prefer, unless the child wants the parent in the room,
Okay.
for the initial consultation, talk, and so forth. I have mom and dad in there. But then
Right.
for the actual hypnosis or my intake with the child separately, I tell the parents, sometimes you might want to say, I hate my mom or dad, and you don't really mean it, but that's how you feel. And if mom and dad are there, you can't really let go of that anger. Okay, so I let the parents know that that's my reasoning so that the child can feel comfortable to let go of any emotions that are coming up. And I tell the child, you can tell mom and dad anything that happens in this room, but I will not. The only thing I will tell them is if somebody is like, touched you or really scared
Right.
you, I will tell them that. But everything you tell me is private, but you could tell mom and dad anything that happens in the room. And, I say that to the parents so that they know that, of course, if there's something that I need to tell them, I will. but I need the child to feel safe. And I let the child make the decision. I was working with a young gal with a genetic disease and a little stomach issues. And when I was teaching her self hypnosis, I had the mom in the room with me, and I taught the mom also because the stress in their life was so great. I felt the mom needed to learn this also, right?
Well,
And
also, when the child's having a difficult time, then the mom can remind the child, you know, let's take out your toolbox, your imaginary toolbox, and what can you do to help this situation? Um,
exactly. And yeah, so it's like playing it by ear a little bit. Every situation is different.
Now, in California, are hypnotists licensed in any way? Are they regulated, or is it pretty much
No,
the
we're
same across
not
the country?
regulated at all. The only thing that you have to put that in your website, I believe, if you know. And then for
Okay.
me, I have to put down that I'm not working as a nurse. I'm working as a hypnotherapist. So
Okay, because I know one thing that I am acutely aware of is, not to cross the boundaries. I'm not going to act like a psychiatric nurse if I'm here as a hypnotist. Uh,
exactly, yeah.
I have to be very careful. Even with the show, I have a disclaimer that the ideas of the guests are not the network, and always consult your medical provider.
I
Um,
always do that. I always say, and if I'm going to mention some new thing, I say consult, get in touch with your doctor. When I'm working with certain people, especially like for IBS, where a lot of them are referred from a physician, then I go back and forth with the physician, letting him know are we making progress? Are we not making progress? That type of thing.
Right. Well, if I have a patient that I know is under psychiatric care of a provider, I usually kind of operate like I would with home care. I tell them that I don't want to work with them unless their provider says it's okay, because I don't want to upset the apple cart and get something that I'm not prepared to handle, or could be a problem, and make sure I'm not going to undermine whatever the provider's doing. Uh,
Right. And I also make sure if I'm working with someone, let's say with heart disease or whatever, and they're on blood pressure meds and they've lost weight and their blood pressures, contact your doctor, let him know how you're doing and that he could talk to you about lowering whatever medication it is. You do not
right.
do it on your own. I always emphasize that you have to do it with your doctor because there's things that happen if you don't do it right.
So with children too, do you do well, I guess the test anxiety, but how about like sports performance, motivation, that kind of thing?
I personally haven't really done like sports stuff with children, but
Okay.
definitely for self-esteem, that's a big one. That's a
Right.
big one. And for helping them to feel good about themselves. And not that much, a lot with pain management in children. If they're
Okay.
going medical procedures, teaching them how to go to, wherever place
Right.
they need to go to, how to turn down the dial, those kind of basic pain management
Okay.
skills, definitely.
That's
Uh,
good, because children don't handle the pain meds, as well. And with the opioid crisis, have you found that your pain management has certainly increased your clients?
uh, yeah, I, 2 days a week, I do sedation for a pain management practice.
Okay.
Um, it's that conflict, right? The doctors prescribe the meds, and it,
Well, at
what
least
can
on the East Coast, I assume it's national, the doctors really are very leery about prescribing. Many nurse practitioners just graduating don't want a prescriber's license because of the mess.
yeah,
Um, or they'll refer you to the pain clinic, so that way the general practitioner doesn't have to do anything. And the time you
right.
get an appointment with the pain clinic, what do you do in between? It's usually a delay.
I
Uh,
happen to be blessed with this particular pain place. Well, I work in the area where all we're doing is the surgery, the
Right.
procedures. But in their clinic, they actually have a psychologist on staff, and they give classes in in mindset and so forth. So it's a good place. They don't utilize me. They already have their own psychologists who are licensed, and I get it.
Right.
However,
Yeah.
when they're being done without sedation, which happens, then they have me help.
Ah,
So uh,
well, and
they
it's also used in childbirth. There are some hypnotists that specialize in, the preparing with the mothers before delivery, um, and using those techniques. And it helps with the people that want natural childbirth, or ones that for some reason can't have the anesthesia, or whatever. That's another common use. I found it in the medical field.
yeah.
Um, what is gut directed hypnotherapy? Is that where you're asking inside what you need, or what is that?
Well, gut directed hypnotherapy is what we use specifically for IBS, and it is about retraining the musculature of the intestines, along with
Okay,
retraining.
excuse me just a minute, Seth.
Yeah.
Can you stop this? I'm sorry. I missed my prompt again. We'll come back in a moment, okay? Because I want to
Okay.
hear that story, but he needs to do his thing. I'm terrible at that. Okay.
That's okay.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet every Monday at noon Eastern on Dancing with Words, Dancing with Wisdom on the BBM Global Network, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Okay, we're back with Seth Roth. We're talking about gut directed hypnotherapy. And one thought I had before the break, if you look at the chakra system, the gut is like kind of your basic, everything comes from the gut. So tell me what you do with that as far as hypnosis goes.
Well, I follow a protocol from Chapel Hill by Olaf Paulson, I think was his name. He just retired. And you have to be a medical licensed person in order to have his protocol. And his protocol is a 7 session every 2 weeks. You have one session one
Okay.
week, and weeks later another, and you do that for 7 sessions. So basically 14 weeks. Each session is a different script, and it's
Okay.
progressive in calming down, noticing how you feel, being in a cabin, not there's ice on the windows and you're comfortable inside, different images.
Kind of mindfulness training.
Huh?
Kind of mindfulness training. You know.
Yeah.
make them
and
more there.
I'm making, being in that cabin, not paying attention to the storm outside and different, and it just builds upon itself. And then also every day you listen to that same script.
Okay.
I And so you are retraining your thinking, you're retraining your gut, and understanding that like there's more serotonin in your gut, there's more glial cells, which are the cells for the brain in your gut. There's a real brain gut connection, and it's a bi-directional system, and it works. I've had quite a few clients who don't like to wait the 14 weeks. They want it boom right away. And
Right.
so I have, if that's what the client wants, and I have done that where I've done just every for 7 sessions once a week, right?
Okay.
So far it seems to have worked as well. They have the MP3s forever that they can listen to. And
Okay.
that's what it is. It's about retraining, and you have to let people know that it takes time. Just like, when you build a muscle, it doesn't happen overnight. You have to go to the gym 3 times, 5 times a week, three
Right.
sets and so forth, and that it takes time. And to have people understand that is really important, so that they know I'm going to be putting this effort in, but I am going to get results, that it's a proven system. His clinical studies were like with 10,000 people, something like that. I mean, it's been
Okay.
clinically proven. And then you have the a fellow in England, Whitemore, I can't remember his name, also doing clinical studies.
Okay.
Why gastroenterologists, the GI docs, do not refer more? I don't understand, because this is one of the few areas that have been clinically proven to be helpful. What they will do, they'll do all the workup, right? All the, colonoscopies, the EGDs going, into the
Right.
esophagus, samples, blah, blah, blah. So they do all the workup. And I don't understand why they're not referring more. I really don't,
Well, I
because,
think it's probably going to take more nurses getting into the evidence-based research to get it done and published.
yeah.
And like I, as an infusion nurse, I frequently administer the Entyvio and the Crohn's disease. And one of the things I'm doing in this series is, in addition to presenting different practitioners and modalities, I'm going to have some shows that focus on a particular chronic medical problem, such as Crohn's, diabetes, cancer, MS, that type of thing, and what they can do. But I'll go in to do an Entyvio infusion in someone's home, and I'll say, "What kind of diet are you on?" "Oh, my doctor said I can eat anything I want." You know, uh, well, yes, he's making money off of your visits. He
Wow.
gets money from the drugs. But I get that so often that I had an allergist once years ago. His son was my patient. He was a juvenile diabetic, but he was getting IVIG, and since his father was a pediatric allergist, I said, "What do you think of the gluten-free diets?" Now, this man was Italian. His hobby was cooking, his pasta. He said, "Oh, it's just one of those fads. It'll go away." Um, so the conversation ended there. I didn't pursue it. I thought
Yeah.
maybe I could get somebody to get people at a young age to, but no, he says, pasta doesn't hurt you.
Yeah.
And he also smoked. It's crazy what, and for cancer patients, I had, cancer often feeds on sugar,
Oh,
processed
absolutely.
sugars and processed foods. And I walked into a home, and man was new to chemotherapy, and he said, "What should I be eating?" And on his table was 10 cases of tasty cakes. And I said, "You need to ditch the tasty cakes." And he said, "I don't normally eat sweets, but ever since I started treatment, I've just been craving sugar." So I had to explain to him that the brain is talking to his stomach. And, he bought those tasty cakes because, the cancer was saying, feed me, give me sugar." And he
Wow.
didn't recognize it as that, but I've seen that many times. People say, "I never had a sweet tooth until I had cancer." Um,
Really? That's
yeah,
fascinating. I work with a lot of people for cancer treatment, not basically to stop the cancer, right? But for
right,
the side effects of the nausea, the lack of
right,
energy, the self-esteem also. That's a
yeah.
really, and also the
There's
different,
also a grief process in that work too, because they're losing something or they feel inadequate because of something, you know.
and with the caretakers as well. And I've had enough people to comment where their husbands have left them.
That
I've had
happens a lot with breast cancer, more times than, I would like. It's awful, and I really
that.
try to support those patients because they feel like, they ruined their life for their children. They don't have a father in the home now, and it's all because, I mean, the relationship must have been shallow to begin with that you would walk away with that. But
Yeah,
uh,
like the time when you need your mate most and they
right,
leave. It's
yeah,
just mean, just plain mean. I'm sorry.
yeah,
But yeah, so I work a lot with people that way. They're fascinated about the sugar. I
yeah.
know about the sugar and cancer, but I never, you've had more experience dealing
Right.
with it. People would suddenly have a desire for sugar.
It's
Wow.
more, it's like a craving, like when you're pregnant, it's really intense. And I experienced it myself, it's I went on a macrobiotic diet back in those days. We had a local store that prepared meals. I didn't have to cook. It wasn't any work, so you
Yeah.
don't need to be that extreme, but you need to use like sugar in the raw or agave syrup and no processed foods, no processed breads, things like that, and that and lots of vegetables. That will help the process, and it also helps a lot of the side effects too. If you're eating things that just clash, um,
Right.
but I work with there's a book by Colin Tippin called Radical Forgiveness, and I recommend that sometimes because if the client can forgive themselves, for just even feeling inadequate, and forgive the people that, it doesn't mean that you're getting them off the hook, the people that have hurt you, but as long as you're holding on to that anger, it's not healthy. And anger is related. There's a direct relationship between anger and cancer. Um,
Yeah.
you know,
Absolutely. Absolutely. Yeah. And it's letting go of the anger, forgiveness. What I tell people is not that we condone what happens, but we are all human beings and we all screw up. And holding on to something from the past is just hurting yourself because
right.
you're making your own hormonal neurotransmitter changes, which are harming you. And
Yeah, the
so
blood pressure goes up. You don't, medicines aren't effective as they could be. I also recommend gratitude journals and kind of present it like, you're going to have good days and bad days, but if you can think of even three things to be grateful for every day, or when you're having a hard time, you realize, be grateful for the good doctors you have, for the family that is supporting you, and things like that. And they realize, and someone will sometimes will say, "I'm grateful for the nurses. They've been," we don't get that much very often, so that's always nice.
yeah,
But and I also, with just the journal for the whole journey of the cancer journey, you might be having a horrible day, but if you go back in your journal, you realize, gosh, 2 months ago I was much worse than I am today. Today's not so bad. You put it in perspective,
yeah,
uh, and I didn't realize because I am Jewish, but meditation, of course, is part of the process. With the self hypnosis, even, and the Catholics with their rosaries. That's probably one of the most basic original forms of meditation because basically it's like a mantra you're saying over and over and over. And some of my Italian ladies, and had one lady, her sister, every day said 1,000 Hail Marys for her, and I was late one day, and it was during the time that I was having issues with my kids and everything. I was a single mom. And
right.
I said, "Oh, did you get a late start today? You're usually done praying by now." And she said, "Oh, I did Jenny's Hail Mary." She said, "These are for you. At the rate you're going, Jenny's going to outlive you." And I was so embarrassed. But, and it really let me understand, first of all, people see it if we're burning the candles at both ends. And, if I don't take care of myself, I can't take care of my patients. Um,
Exactly. Yeah.
and sometimes the way healthcare is nowadays, you don't have time to take care of yourself. We literally don't have time to go to the restroom many times, and forget eating.
I've actually started taking Wednesdays off. I got a text just yesterday. I had worked. I also work in a dialysis surgery.
Okay,
Andrew,
we're getting a notice again. Let's hold it right there, and then we'll close up the show. Thank you.
okay.
You can have it.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick, Wednesdays 7 p.m. Eastern on the Bold Brave Media Network and TuneIn Radio. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation.
Okay, we're back with Seth Ross, and as we close the show, I think it's been very interesting. If anybody has any questions, you can email us. Seth, how would a customer or client get in touch with you if they had any specific questions or wanted to avail themselves of your service?
Sure. Well, just call my direct line, 510-552-7576. And if I can't get to the phone, just leave a message. Or my email, Seth Deborah, no hyphen, just SETHDEBRAH at hypnotherapy4health.com. There you go.
Okay. Well, it was great having you. It was very informative. We've got a lot of work to do as nurses, I think, to keep promoting and educating people. And that's what I'm hoping to do with this series, is help empower the medical consumer to take a more proactive role and take some of the responsibility for their care. And it's working out really well so far. We have a lot of exciting guests coming up. So
Thank you for inviting me. Thank you very much.
it was great having you. Thank you for coming. And we'll see you next week. Down the road, we have a shaman from South Africa coming. We have some people in Australia. We've got some music shows, an animal communicator, holistic vets, and holistic doctors. We've got a lot to go finish out the year with, so it's going to be exciting. But it was great having you today. Thank you for taking the time.
Take care. Bye,
Bye.
everybody.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, noon Eastern on the Bold Brave TV network.